shockwave therapy and how it works. So I started going down the rabbit hole and researching things because I have some knee issues. Hurt some knees, tore some tissue, all this stuff. I started diving in and learning about shockwave therapy and how it could help. Before I get started, when you go down this rabbit hole, you're going to get a lot of stuff on ED, erectile dysfunction. That is not what I was studying it for, but apparently it works for that as well as it works for other things. But once I started going down it, I learned that you can buy shockwave machines supposedly on Amazon for $500 to $800, as well as there's machines out there that cost anywhere from $40,000 to $80,000. So I was curious, like, what's the difference? How does it work? I actually received both therapies. One is called radial and the other one's called focused shockwave therapy. And I'm gonna move to the screen and kind of go through the difference on what that is in the machines and how they work. So basically you have radial versus shockwave therapy. One is supposedly works more superficial, has a slower impulse, lower energy. It tends to be a little bit more painful. Imagine it like a hammer on a Theragun, right? So for example, a Theragun with a lot harder pressure on that joint or body part, and it's just hammering away on a lower frequency thing. The premise behind that is it creates waves throughout the body, vibrational waves, shock waves that then can help maybe possibly regenerate stem cells, help kind of get the tissues, build more blood flow and all that stuff. So there's a great video if you want to watch. It's on this website, versus radio versus shockwaves. It kind of dives into it in more detail. And I'll have that play and I'll have that link in the description below. But like I said, radial pressure waves, some people consider this not a shockwave at all. It's a very low frequency and it's supposedly more of what's considered a pneumatic pressure, similar to like ultrasonic pulse. Audio acoustic pulse is very low in that regards from a slow shear wave. Then the other one's a focused shockwave, which is hard, smaller focal point, greater accuracy, and greater treatment depth. It supposedly can get down. So for example, in my knee, it can go pretty much all the way through because the knee is not that big. So 12 centimeters in depth, precise energy delivery, fast impulse, much higher energy and from a density standpoint. So if we break down the pressure waves, you can see in here the pressure waves on how much they're produced on the radial, which is low energy density, and then the higher energy for the focus shock wave. You can see a much greater amount of pressure. When I had my therapy done, I had radial and focus shock wave. They both were painful. They both seemed very similar in how they felt. So I can't say one versus the other. When I started getting therapy done, I did more sessions on radial therapy than I did on the focus shock wave. Did I see an improvement? I actually invested in a radial pressure machine for a while because I didn't realize there was two different types and that one would be more effective than the others. And I'll kind of get to my conclusion on which one I thought worked better and what was worth it from an investment standpoint and so forth. So again, you can see like most therapies, they talk about it like it's snake oil. It can heal everything: acute injuries, joint, bone, shin splints, osteoarthritis, Achilles pain, tibialis posterior, whatever. I'm not going to read them all for you, but you can go into, like I said, I'll include these video links in here and they break it down. So why are they different? What's the difference? And by all means, if you're a therapist, you know more than I do, please comment below. Tell me what your thought process is. If you've had shockwave therapy before, comment below on what your thoughts on versus radio as well as the focused. So diving into the research a little bit more, this company, Lasara Group, will say not all shockwaves are the same, as well as the research out there will say not all shockwaves are the same. I'm going to base it off. The reason why they say this is because the studies out there have only done research on more focused machines than radial machines. Don't get me wrong, I don't know. That's just my conclusion on this. So if you dive into it, it's basically saying radio is not creating a sound wave. It doesn't have that penetration, that deep therapy. At the same time, no different than a Theragun, a radio machine is a much more deeper or higher pressure than a Theragun, so it can heal more soft tissue, surface level stuff. I don't know. Or and aware that a Focus One, where the Focus One, the research was done on more kidneys, breaking up kidney stones. It's more deeper penetration based off the research that is out there, and that's basically what it's saying in regards to that, because the waves are more like sound waves. They're way higher in frequency, like millions of times more than just a radio wave. And like I said, once you dive into that research again, you can do focus waves, target zone conversion, divergent skin surfaces. It dials in the different types of machines that are out there. I've noticed that multiple companies sell both types of machines. So for them to say that one doesn't work versus one that does work seems a little ambiguous, because they sell both types of machines and you can get both. So when you get into the machines, I'll show you one more research study, and this is by Herman Wallace. Stacy Roberts talks about this and what the shock waves are, what shockwave therapy is, how long it's been around, about 1970, the different three types of shockwave: electrohydraulic, electromagnetic, and piezoelectric, which I probably butchered that. Why is shockwave therapy beneficial? And again, I had some good results from different stuff. So I also used it on my feet because I was having some feet pain, and the radio shockwave worked great. I also did the radio shockwave on my knee, and it did help recover it and get back to almost 100% before I pushed it again and did some more stuff. And I have an MRI that shows all the things and tissues that's kind of been broken down, and I've even done other therapy, but now I'm back to about 100%, and that was not using any shockwave therapy. So like I said, when I get down into it, shockwave therapy claims that it does all this thing. Shockwave, more electrohydraulic, produces a way bigger pressure and on that aspect. And so like I said, you can dive into the research in here, but it seems a little bit sparse, as in there's not much research on any of them or all of them. There's just a little bit that's breaking down more of the acoustic waves, radio in that one, and they try to push to machines that are more of the focus shock wave. So diving into those machines, if you look into those machines, like the electrohydraulic system, enhanced treatment, it's deeper penetrating, the focal length in here, increased range of power, very quick treatment, by the way, is done in about 15 minutes and so forth. You can actually get people who will do this treatment. It is out of cash paying. They'll normally do an initial session for like $49, and then they try to charge you for 12 treatments for like $1,000 or $2,000 or something for that regards. Where of course the radio one, you can buy a machine on Amazon for anywhere from $500 to $2,500. The focus shock waves, as you can see in here, they're a lot more in depth. I'm not sure why there's a huge price difference in between the two. One, of course, is a medical wave. You can see it as focal dip penetrates a lot deeper, higher frequency. So this is probably why there's a huge price difference in between the two. But like I said, most companies sell both, which is suspect if you ask me. So if you can see here, this is one of the machines. It's focal around 58,000. I did find that most people, you get treatment from the focal, they'll claim that the machine costs 80,000, but as you can see here, you can get it for 57. And then this one, you can see off a DH gate, it's around 19, so 2,000 time you pay shipping and all that great stuff. You can also get it on eBay for 3,200. This one offers multiple treatments from a radio. You can also get ones on Amazon and so forth and have it treated that way. But again, the huge difference between them, they talk about physics of waves and sound waves. So sound waves have a much bigger amplitude and a higher frequency, and that will penetrate supposedly deeper and help with stem cell regeneration as well as healing from those tissues and create more vibrational force within that tissue that would then hopefully heal it. And like I said, you can get into research and see more on the hertz that it's produced. Ultrasound 20,000 hertz, shock waves. And here you can see faster than 343 meters a second. So it's creating essentially a sound wave with that. They say this one does work, where they'll talk about where the radio waves do not work. They're not effective. But again, obviously Theragun works. It is effective. They are creating all kinds of different types of waves. Which one is more effective, obviously, will only determine in time. And it's still fairly new out there. That's why I'm talking about it. I'd like to bring more information out there regarding this subject. So again, another machine of the Focus Shockwave, setting new standards. They say this one isn't as painful, but again, I experienced that they were both about as painful as the other one. Focus one may be a little different because of how it was, but it was on my knee and it definitely did not feel great. It wasn't horrible. I did get really good relief immediately after on both therapies, the radio as well as the Focus. I ended up going a different route and finding a more effective and better solution to recover my knee. So happy that is worked, but both of these treatments seem like they can be very effective, and I'd like to get more research and data out there. So please comment if you've ever had any of these treatments and which one do you find to be more effective and what works best. Like I said, feel free to watch this video. Again, it seems like chiropractors and other people are jumping on this because they know they can charge people cash, and it makes all these claims. Obviously, there's a huge market in the ED community, which, wish the best in all that department. Fortunately, I don't have to worry about it, but at least right now. But anyway, like I said, I'm concerned about these treatments, or not really concerned, but want more data and want more feedback. So please comment and let me know. And hopefully this helps educate some people, because I had no clue the difference between radio and focused, electromagnetic, pneumatic, all these things that I had to do a ton of digging to get this data. So hopefully it was helpful, and it will save you guys tons of time and information. And if you use it for a therapy on yourself, then like I said, please comment and leave your feedback below on what you think of the therapy, on what you used it for, if you're open to sharing that. Otherwise, I appreciate it, and I'd like to get more information regarding this treatment. All right, thank you.